let's discuss the extra point, Dannangxue gallbladder point and Lanweixue appendix point. Location on the GB channel of the right leg, approximately 1 to 2 tune distal to gallbladder 34. Palpate for the most tender point. How to find? First, locate GB34 on the right leg. Locate the head of the fibula on the lateral aspect of the leg where the seam of the trousers would be, and hold it with the index and middle finger as with tweezers. By gliding distally with both fingers, the index finger will come to rest in a depression directly inferior and anterior to the head of the fibula, GB34. From there, continue to palpate slowly along the GB channel until you find the most tender point approximately 1 to 2 tune inferior to GB34. This is the location of EXLE6. Needling vertically 1 to 1.5 tune. Actions, indications, clears heat and drains dampness for acute and chronic disorders of the gallbladder such as cholecystitis, cholelithiasis. Tenderness on this point is diagnostically significant. This point is frequently used if it is tender on pressure to expel damp heat from the gallbladder in cholecystitis or cholelithiasis. Resolves damp heat from the gallbladder, jaundice, cholecystitis, or cholelithiasis. Dannangxue gallbladder point is famous for its application in the treatment of both acute and chronic cholecystitis and cholelithiasis. In the majority of cases, it becomes tender when the gallbladder is inflamed and indeed may perform a secondary role in the diagnosis of these conditions. Dannangxue is one of the few acupuncture points that only exist on one side of the body. Next, we have the appendix point, EXLE7. Location on the stomach channel of the right leg, the most tender point approximately 2 tune distal to stomach 36. How to find? Locate this point on the right leg only. This corresponds to the unilateral location of the appendix on the abdomen. First, locate stomach 36, 3 tune inferior to the knee joint space. Stomach 35, and 1 tune lateral to the anterior crest of the tibia. Then continue to palpate along the stomach channel or approximately 2 tune towards stomach 37, 3 tune inferior to stomach 36, and locate EXLE7 on the most tender point. Needling vertically 1 to 1.5 tune. Action, indication, activates the qi and blood flows in the large intestine, clears heat and heat toxins from the large intestine. The point, Lanweixue, is famous for its application in the treatment of both the acute and chronic appendicitis. In majority of cases, it becomes tender when the appendix is inflamed and indeed may perform a secondary role in the diagnosis of this condition. Lanweixue is one of the few acupuncture points that only exist on one side of the body. This point is used in an acute attack of appendicitis to stop pain. It can also be used in chronic appendicitis. It is also a useful diagnostic aid in the diagnosis of appendicitis, including the chronic kind, if it is tender on pressure. It stops abdominal pain, resolves damp heat, acute and chronic appendicitis.